all the time. You have headaches, muscles and joint pain every day. It's hard to get up. She stopped losing her hair. I'll let you know more about these stories in just a bit, but it's always inspiring to see how miraculous improvement can be when drugs give way to cutting-edge science combined with traditional healing remedies. But first, let me offer some education about autoimmune diseases. In autoimmune diseases, the body's immune system attacks its own organs or other parts of the body. In regular medicine, strong pharmaceutical drugs are treatment. Some of the drugs are also used in chemotherapy. The purpose is to suppress the immune system so it stops or at least slows its attacks. However, that makes people more susceptible to infections, so they can get sick more often. And there are strong side effects that can include hair loss, skin rashes and thinning, acne, mouth sores, extreme fatigue, diabetes, cancer, and more. Some of the drugs can cause problems with the body's organs themselves. Incredibly, women account for 75% of people living with an autoimmune disease. Recent research attributes that to chromosome and hormone differences compounded by environmental toxins and unhealthy foods, and that can also affect men. Altogether, there are over 80 identified autoimmune diseases. Each one affects different parts of the body and has different symptoms. These include lupus, Sjogren's rheumatoid arthritis, Hashimoto's disease, Graves' disease, ulcerative colitis, and Crohn's disease, just to name a few. Autoimmune diseases can be frustrating, limiting, and painful to live with. It's unfortunate that in our society's medical system, regular medicine investigates the mechanisms of these diseases in order to block symptoms, but it doesn't always look at how to treat the possible causes of those mechanisms going bad, which in turn causes the symptoms. I think that's because the medical establishment was originally founded on treating symptoms, like when you have 3 or 4 headaches a week and then you take drugs for it. And it's great that the medication can block the headache, the symptom, but there are side effects. And wouldn't it be even better to understand why they're happening in the first place and then prevent them? For naturopathic doctors like myself and our associates, that's where we step in and step up. We may prescribe the drugs temporarily, but we focus on getting our patients off of them just as soon as possible. And when it comes to the patient care, I think many of you would agree that that's the better approach. Our other doctors and I are naturopathic physicians, a medical specialty that combines cutting-edge science with traditional healing remedies that empowers us to replace pharmaceutical drugs unless absolutely called for, with healthy foods, enhanced nutrition, natural herbs, and other healing remedies. We're also trained in acupuncture and Chinese medicine, which gives us 2 additional and powerful nature-based medicine tools. If you would like to talk with me about a health concern, just call or text our office to schedule a free of charge phone consultation with me. We always want to make sure that what we do fits your needs, and you'll find all of the contact information on our Facebook page. Let's talk about what we look for when treating autoimmune diseases. We often start by prescribing vitamin D in certain strains of probiotic bacteria. That's because when the immune system is being suppressed by drugs, it can't fight off infections as easily. So we want to help it do its job and not have the patient so weak that the person gets sick all the time. Also, many of the gut bacteria have been found to influence the immune system in autoimmune diseases. So that's where probiotics, very specific types of probiotics, can be helpful in addressing some of the root causes. We also screen for heavy metals like lead, mercury, and arsenic, which can be triggers that set off the immune system. At the same time, we're checking for other kinds of toxins like pesticides, herbicides, and microplastics. Processed junk food, sugar, and other kinds of foods that are highly processed can feed bad bacteria in the gut and lead to the immune system becoming weaker. So we work with the patient to develop a healthy food plan that fits their lifestyle and pocketbook. 3 other functions also affect the immune system. Methylation, the body's detox pathways, are also important for keeping the immune system healthy. Hormone imbalances can tip the immune system out of balance, and dysfunction in the digestive system can do the same thing. So the key is that we need to do testing, figure out what the imbalances are, and what do we need to do to address the root causes so that patients can actually improve. Let's circle back to those two patients, both women in their 40s. The one with lupus suffered from brain fog, heavy fatigue, and severe joint and muscle pain. She suffered from an overgrowth of certain bacteria in the gut that show up in people with autoimmune diseases. And in addition, she also has endometriosis, a painful condition caused by improper hormone levels. Her treatment goal was to get off of the immune suppressing pharmaceuticals, whose side effects can be awful. This was during COVID, and besides the side effects, she was worried about getting sick with COVID with a suppressed immune system. The extensive lab tests we always do for our patients told us how to successfully approach her treatment. We prescribed medical grade herbs and supplements to support her body's immune system. We found high levels of mercury and other toxins, so we did a detox protocol for her. To get her hormones in shape, we worked with her to develop a healthy food plan. She is now off of pharmaceutical medications completely and enjoying life a lot more. This can be life-threatening. The immune system can attack the heart or the kidneys or other organs, but she's never had to go back to pharmaceuticals, which is amazing. She happily uses our natural medicine protocol instead. Her endometriosis symptoms have improved to the point where the pain around her period is easy to deal with. She tells us again that she feels better now that she's off of her medications than when she was on them. Our other patient had Hashimoto's disease, where the immune system makes antibodies that attack the thyroid gland, which is a gland here in the neck, that cause it to underproduce the thyroid hormones. She also suffered from SIBO, a condition of bacterial overgrowth in the intestines that caused constipation, bloating, gas, and nausea. Her abdominal pain was intense, to the point that she was scared to eat more than a tiny amount of food each time. She was also dealing with other difficult symptoms, including low and sluggish energy, brain fog, constipation, and hair loss. We found a high level of toxins in her body, and her detox mechanisms weren't working properly, so we developed a protocol for her using specific foods, herbs, and special detox supplements. For her intestinal condition, we prescribed certain strains of probiotics, an anti-SIBO diet, and herbs to help to kill the overgrowth. All of her digestive symptoms resolved completely. Her energy came back, there was no more brain fog, so she could think clearly again, and her hair loss stopped. I trust that our discussion today has been useful for you. I'd certainly welcome the opportunity to discuss your specific health concerns so that you too can be empowered with your health. To do so, just call or text our office to schedule a free of charge phone consultation with me. We always want to make sure that what we do fits your needs. You'll find all the contact information on our Facebook page by visiting our online supplement store, which is on our website at drtaketa-wong.com. That's drtaketa-wong.com. With a 20% across the board discount, our prices are very competitive, but the main thing is that the proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video. Mahalo, and I look forward to seeing you in 2 weeks. Aloha.